You say hi, you have not started saying what is the concept of therapy.
Good evening, everyone. We welcome you all to OrthoTV online financial Friday session in association with my financial advisor. I take great pleasure in inviting two of my very senior colleagues, Dr. Ram Prabhu, who is a consultant orthopedic surgeon, has his own hospital, and his partner in crime, in life and in hospital, which is Mukund Hospital, Nanderi, Dr. Meena Prabhoo, who is an eminent practicing consultant gynecologist on the verge of retirement. So, a little bit about MFA. It was established in 2005, is only company in India having a dedicated practice for doctors. While working with the doctor fraternity for 15 years, they have met over 3,000 doctors and have a deep understanding of their lives and financial life cycle. They have done a lot of webinars with us during the lockdown, and this is in continuation with a series where we started doctor finance groups to enhance knowledge for doctors. We have with us Ms. Chanda Varma, who is the Vice President and a financial coach at MFA. She has been dedicatedly working with the doctor fraternity for the last 7 years. She has over 15 years of experience working with leading organizations like GE Money and HSBC Bank. She has also been certified by the National Institute of Securities Market, NISM, as investment advisor. So with no further ado, I just hand over. And before that, I would like to introduce our panelists, our orthopedic financial experts, Dr. Sanjay Dhar, who's Dr. Sachin Kale, and Dr. Prasad Chaudhari. They are being professors in DY Patil Medical College. They also have their own private practice. And looking forward to a great conversation today, I hand over to Ms. Chanda Varma. Over to you.
Thank you so much, Neeraj. It's always a pleasure to be here and talk to you, meet you, and of course to meet Dr. Ram and Meena Prabhoo. So welcome everybody. Welcome to this session, Friday session on planning your dream retirement 3-step part. Now, Dr. Neeraj, just before we start, I'd just like to share 2 slides, giving them a little more introduction about the firm so they understand the concept where we're coming from. So Dr. Neeraj has already said that we are the only firm in India with a dedicated practice for doctors. We've been doing this for last 15 years. So we specialize in 2 things: helping doctors make prudent and informed decisions about money and financial literacy. And having met, I think, more than 3,000 doctors over the last 15 years, we've kind of grown with this community. We've been a part of their lives, their challenges, what makes them tick, what ticks them off, or their passion, etc. And it all started with this book. And I want to share the image of this book with you because I think a lot of you might have gone through it, even read it. Now, this was the book which was published by CNBC TV18. It's been written by our founder, Mr. Amar Pandit. And it is this book which actually turned the tables for us, because when we used to meet doctors earlier and we used to talk to them about planning for finances, about planning for their goals, they showed no inclination. They didn't have the time. And all they would tell us is, well, मेरे पास पैसा है, मैंने invest किया है, mutual funds है, stocks है, FDs है, insurance है, it's okay, I'm sorted, I've done my planning. But when we presented them this book and they went through the book, thankfully, they went through the book and then they told us actually I felt like Amar was talking about my life, my story, my perceptions about money, my mistakes. And slowly, one after the other, the doctors started becoming our clients. And today we have more than 300 doctors as a part of MFA family. We also have been associated with a lot of associations for financial literacy sessions. So we've been literacy partners with the Indian Orthopaedic Association. We are there on their app. We've been present at IACon talking about chain to the chair, Indian Society of Cardiology, BIROC, UCCon, ASPA, which is by the Pediatric Society. We've given talks at Sion Hospital, Apollo Hospital, and the Fellow Gynecology Society of India. So that is a very short introduction that I have on MFA. But that brings us to today's topic. And the reason why we are having this topic, let me also give you quickly the reason why we are having this topic for discussion is because also what we all have experienced in the last 1 year of this COVID pandemic. See, pre-COVID, when we would talk to doctors and talk to them about retirement, they would laugh and they would say, I'm never going to retire. What is retirement? What will I do after retirement? I'm going to work till my body allows me. There's no retirement for me. And that was the norm. But during COVID, with all the changes that happened, the practices were hit. We saw so many doctors come and tell us that almost 90% of my income has stopped. And then we saw some change in the doctor's mind when they realized that there are uncertainties. Voluntarily or involuntarily, you may have to slow down. So we had younger doctors who came and told us, I don't want to be like my predecessors. I want to be someone who's okay to be able to slow down at the age of 60 or 65. And we also had experienced doctors who came and who told us, why should I take the risk and work till 70, 75? Let me see if I am placed well enough to slow down maybe at 60, 65 now or in the next 2 or 3 years. And therefore, we ran a campaign of this 3-step retirement planner for all doctors. And we reached out to associations because I believe associations always work for the well-being of doctors. And financial well-being is a very important part of the overall well-being. And Dr. Neeraj has been absolutely enthusiastic and helpful in bringing this forward. And so I'm extremely happy to have this conversation with none other than Dr. Ram and Dr. Meena Prabhoo, who we all know, but we respect them for their simplicity, for their humility, for their helpful nature, for their passion towards their work, basically for the people who they are. And I don't know about doctors, but for MFA and for me personally, they're more like mentors. They're the family we chose. We talk to them about anything, not just money. We talk about family, we talk about values, we talk about life, we talk about kids' problems. In fact, Dr. Meena has come to our office and even given a lecture on how to maintain a work-life balance, which they have done beautifully in their life. And any medical related issues anybody in our team has, they are the first we reach out to and they're most helpful. So I'm so glad, Dr. Ram and Meena, that we are going to talk about this topic, which I believe has a love-hate relationship with doctors. Don't you think so? So I would like to start with asking you a question that during this last 1 year, when we also haven't really been able to meet, but we've always had conversations on Zoom and etc. How has this 1 year been for you? Because I know that this year has really given you the big push to semi-retire, if I can use that word, from your active practice. And you are in a phase of the second phase of your life. So please tell us, how are you enjoying this phase? How was your last one?
First of all, to begin with, it was a very generous introduction from Chanda and Neeraj. I'm really thankful, both of us. And thank you very much, OrthoTV and MFA, who got us together today. And of course, ladies first, so I would ask Meena to talk first.
Hi, everybody. Basically, I feel, because this word retirement is really an obnoxious one, especially for doctors who believe that, oh, we should never ever retire. People, our seniors have, you know, gone by actually working till their last breath. But to both of us, we always thought that, okay, we've been working so hard. We had planned that 40 years we'll work and then we would, pursue our passions. See, both of us complement one another. Ram is very, very, an outdoor person, a person who loves people, loves things, going around. But it was not possible to do it with the timings that we had to stick to, the heavy hospital work that we had to do, and the dedicated thing, because patients don't, especially obstetric patients, you cannot ditch them once you have registered them. So all these things were always on our mind. So even if we went 2 hours away, we were always thinking, would someone phone us? Will something happen? Will she come for delivery? All these things were always there and we never really could relax. Even going out to dinner was at times cancelled at the last moment. and things like that. So we thought like maybe after 40 years we'll do it. And there came COVID. You know, that little virus created havoc all over the world, but it opened our eyes towards retirement, because we believe retirement doesn't mean sitting at home looking after grandchildren, going to the temple in the morning, and then sitting and just, moping around, not wearing the right clothes, not doing things. Oh, you're old now, you're retired. No, it was not that. We, in fact, I would say, given the circumstances, both of us made the best use of it. We enjoyed each other's company, our family company, friends who were very close to us but very careful. They also were, a part of our journey the whole year. And really speaking, we made we really enjoyed our life. Now, coming to what really happened, I think the way Chanda wants to know that when did it strike us and what actually, were we afraid of this situation and all? Well, yes, I can say. See, when our Prime Minister told us on 22nd March that you should have this Jan curfew,
Yeah.
on your own, voluntary. It was all fun. We were, thali bajawing and laughing and joking. And we always thought, oh, fevers and viruses and infections go away. I mean, it'll go another month or two maximum. It'll be like a good long holiday, which is thrust on us. No patients, no nothing. Just sit back and enjoy yourself. That was the attitude that we thought. Suddenly after the 24th, when things started shutting, no shops were opening, there was nobody around, there was zero patients in the hospital, everything, every other person, and most important, when there were, the whole world was having so many deaths, including some of our friends who were critically sick in hospitals, and some of them are no more today. We realized that this is not going to be just a short affair. That is when we contacted Chanda and Meena, because they are our financial coaches. And we said, please, Chanda, first and foremost, please look and see if we can sustain this with zero input from our side. I don't think we can get any money. We are not expecting anything from patients. Patients themselves have no money. So they're not coming to the hospitals. They're scared of COVID. So what do we, do? Can we manage? And hey presto, they had those figures. They said, give us a, like few hours, and they came back to us. That was a big relief that, well, not only for this couple of months, but we could both sustain ourselves with the same lifestyle till we turned 90. They had looked after us and looked after our finances to that extent. So it was a wonderful feeling of relief. I would not say elation, that's a wrong word to use, but it was a relief that, well, we can manage. We don't have to worry, as in worry. The next problem that we had on our mind was our hospital. See, our hospital had more than 25 staff who were looking up to us all these years. 38 years they have been working, many of them for practically 38 years. How could we ditch them? What would happen, if we did not work? But fortunately, our children are from the same faculty. My daughter-in-law as well as son, they have chosen orthopedics and gynecology. So we told them, COVID or no COVID, you need to work. You are young. Even if you get it, it doesn't matter. You will be able to sustain it. Use all the precautions. Do not, be afraid, but you go ahead and run the hospital now. And they did it. They did not think twice. They said, yes, we will manage. And the first 2 vital months, that is April, May, and a part of June, they were at it and kept the hospital going. We kept our hospital as a non-COVID hospital from day one, because we felt we shouldn't, mix obstetrics or our routine patients, because they would go away. And we think long term, because these patients have been with us, these families have been with us for the last 38 years. So we cannot ditch patients and we cannot ditch these families. So we need to be non-COVID. Income definitely went down. Our children had to work very hard to sustain this thing, but we felt good. This was a challenge thrown to them. Why not? They are young, they have less than 40, they are only in their 30s, so they need to work as we have also worked. And this COVID actually forced us to see what they do when we would have retired, not waited the other way around,
Correct, correct,
Ram,
correct.
you have anything to add?
As you know that the doctors retirement is an option. It's not a necessity. That's the reason why we see so many doctors practicing till right old age. And I've seen my teachers practicing till almost 80 years, 85 years, and they are still practicing. So many of them do not do operations, but they consult. And this is what is generally seen in this profession, that people don't actually retire. But then it is important that, and they really don't know where they stand as far as the finances go. And that is one of the reasons why they have little insecurity, and they don't know when they can actually retire or semi-retire. And this is what is very important, that the doctors should know where they stand financially. And I think this is an awareness that we realized with MFA giving us advice. We realized that, of course, we can sustain like this till the age of 90. We have, of course, enough. There were lots of people who had given us advice in the past. There were some true advisors, there were some fake advisors also. And in the sense, we had some mutual funds, stocks, gold, real estate, but we couldn't gather it together. We didn't know how much are the calculations of this, and how long can we sustain with this kind of saving. Supposing we stop practice today, whether we can sustain. And that is what the realization that we got it from MFA, that yes, we can definitely do well. Of course, you want to continue practice, you can, but there is no need to really work hard. And we have lots of hobbies, lots of aspirations, lots of things that we have to do, especially traveling, that both of us like, which we could do. And we realized that we can actually do all those things.
I know I heard about you going sailing, you played golf, you went on road trips, obviously keeping
Yeah.
safety precautions. But
Yeah.
that is lovely, because I think that is the kind of retirement you want to visualize when, and when we talk to doctors, like you rightly said, that is what they think. They don't think retirement the way you're putting it out, and
Yeah.
that is what retirement really should be. Retirement should be the freedom of choice, that I am working because I want to, not because I have to. And it's always good to know you don't need to retire. You can still, Dr. Ram, you can still go and work for 10 hours a day, but you choose not to, right? So I think that is really what it is. But you guys have embraced it, which I have not seen very common among doctors. You guys embraced retirement even when you thought you weren't going to retire right now, but you've embraced the retirement. So can you just talk about how you really started thinking about retirement? It was definitely not in the last 1 year. It was something that was there for many years in your mind. So how did you start retirement? And you also run a hospital with partnership, so that also complication would have been there.
Well, to answer your question, we, like, from the last 38 years, we have a very competent couple who are our partners. They are also gynecologists and anesthetists. So they, knowingly, we got into this partnership, and I really feel that was the biggest. It is like a second marriage for both of us. The first one is with Ram, and the other is with our partners. And like any other marriage, there are always compromises, there are always, advantages. If you look at the positive side of things, two things I tell youngsters, and I would sincerely tell all young doctors: try to do group practice. All you need to do is keep your ego aside, be very clear on money matters, and then don't have to look back. Because we feel, because of this partnership and the lasting respect and love that we have for each other, we have been able to achieve a lot together. In the sense, we've always been there for all our families, including our children's highs and lows. There was never a sickness that I think I have neglected my children, or at any time we have not gone for their even a graduation or even a football match. One of us would always see to it that we were there, however stupid and silly their event may look now. So we were always there. It was never delegated to maids or nannies. Then later on also, and all this was possible because of the partners that we had, because when we wanted to take off or go for a small holiday to Mathiran, they were there. And when they wanted to take off, we were always there. We've never taken a holiday together. Last evening was the first evening that four of us went out to dinner because it was their wedding anniversary. So it's so much commitment that we never took any holiday together because the patient should not suffer. So we shared our patients, we shared our incomes, we never had any arguments. So that worked so well with us. So it was not difficult for us to think of retiring actively. You know, retirement doesn't mean I don't go to the nursing home, or Ram doesn't go, or our partners don't come, you know, to the nursing home. They also come to the nursing home. We also go. And but we go at a limited time, in the sense we've restricted ourselves for a limited period. We overlook the entire running of the hospital. We haven't given it on a platter to our children, because we don't believe in giving it on a platter. They need to work for it. So they are the workers, like any other doctor coming to a nursing home. We are yet in control, and that is what, you know, we feel retirement is all about, doing a bit or important part of your work and yet relaxing and enjoying your life the way you wanted to do. See, someone else might just love reading. Some person might just love, you know, doing some politic work or social work. Everyone has different interests. So it's up to the person to decide what he likes to do and do it. And with the help of people like you, see if you're sorted out, you know, because
Yeah.
that gives you the confidence, okay, well, I can do it.
What we realized, Chanda, was the transparency and whatever we could trust you. You know, something like in the childhood, we used to have family doctors. Okay. And these family doctors were practically knowing everything about everyone in the family. You know, not only their illnesses, their health, but also what are their problems at school, whether they have some problems progress and studies, they have a problem, or sometimes even the child goes haywire in their friendship, etc. So they used to solve all those problems. And we realized that MFA is one which is like a family financial advisor, where we could ask them anytime, any time of the day, even the smallest of the things, and we got answer. They really calculated. You all did a good homework about it, and we got answers which were satisfied. In fact, sometimes even whether buying a place or renting out a place, also something like that we have asked.
Yeah.
They calculated, they showed what is better and what is not. And that itself is an important thing. So family doctor concept or a family financial advisor concept is extremely important. You want to say something?
Correct, correct. And Dr. Meena, you remember when we had initially come to talk to you, uh, you had said, listen, I think Ram and I are sorted. We have been working for last 30 years. But I think, you know, this kind of a thing you can help Tanay and Shreya do. So why don't you come over and help our kids? And I remember when we were sitting there and we were taking them through the calculations, the steps, talking about goals, talking about 3 years from now, talking about 20 years from now, just to get an idea about how people think. And you said that, hey, you know, I think this is how it should be, and I want to do it for myself too. So, just for the sake of audiences here, because all the time I meet the doctors, they all tell me we've done things. Everybody does things. You know, Indians have been taught to save. We've been taught to earn and save. We also learn some amount of investing. But the constraint is that the right way of doing things? We all do things our way, but what is the right way of doing things? And I think somewhere in this process, while you were thinking of retiring and you were clear about retirement, you saw the difference in how things were managed. So could you tell how you were doing things earlier versus how were the different steps that we took that helped you get more and more clarity, if it did?
Yeah, you know, like I can tell you, we were super suspicious of you all. You know, though we had been recommended by Sanjeev Kapoor, who's a close friend of ours. He told us, in fact, for Diwali, he sent us Amar's book. One Diwali went by, another Diwali came, we again got the same book, but it just remained on the shelf. Ram told me, Meena, you sit and read it, you know, his usual style. You know, he doesn't like to read anything. So he said, you read it and you see. I said, okay, I'll read it. And I read a part of it. But then, like I did not complete the book or something. So one fine day he said, no, please meet these two young girls. They are keeping on phoning me and coming. So you meet them at least. I said, okay, let me for your sakes. So we said, then, I said, please handle my children's thing. I think we have invested like all people, some agents have told us, FD nikalo, koi bola, MF, some mutual funds, some of them, all haphazard, here and there, everything was there. Thoda gold we used to keep taking every year. Stocks. Some stocks were taken because some friendly person said, no, Reliance upar jayega, ye le lo. But we didn't know why we were taking it, what we were doing with it. And, like someone said, no, this for tax reduction. So we did all those things that people did. We didn't, the capital was always there. It was not that you were splurging. We did it like any other person. And that's it. But when we saw the approach that you both had on our dining table with our children, because they had nothing to lose. Theirs was zero income, hardly any income, hardly anything. So, but yet you all sat with them, explain to them that you will need money when your child goes to school, when he wants to go to college, when he wants to get married, and things like that. And you'll need this much money if you want to buy a consulting room, things like that. And you need to travel, so you need to keep balance. So I said, oh, why not? We've never thought of it this way. I told Ram, I think these girls do make sense, but yet we were very suspicious in the sense because they look too young. I always tell them, youth seems to, you all are -10, whatever you look. That is the biggest problem. So we said, no, I'll go to their office and check out where they are from. So when I went to the office and I got really positive vibes, they have a full-fledged huge office with 50 others working on 2 separate floors. And I was really impressed with the way everybody was working. And Mr. Balan also, who oversees, that is Vidya Balan's father, he comes there and he's such a lovely person. He went and around and made me very comfortable, and we talked about everything. That's when I came back and I reported to Ram, and I told Meena and Chanda, look, I need to complete Amar's book. Let me read it. Don't phone me till I phone you back. I want to read it page to page. I'll read it twice and then I will phone you. And sure enough, in one night I read it and we decided, no, we should also go for it. It's not only Tana and Shreya, but we need it as much as they need. And really, I'm very thankful, because COVID, we wouldn't have handled it, we would have been confused. We would have, not known how much we really had to sustain. That is the reason I think we are very thankful to both of you and to your company for seeing us through.
So, Dr. Meena, the way you said, I'm going back through the journey that we actually had for the last 4-5 years. And honestly, when we meet all doctors, we see all doctors working very hard, 10, 12 hours a day. Younger doctors like your kids, they work even harder because a doctor's life cycle starts so late. They start only by 40, 45. And after 15, 20 years, you've done enough corpus. You've had enough corpus. But just having a corpus, having money, I have seen, like with you guys, it doesn't give you a feeling of reassurance. It doesn't give you the confidence, or it doesn't give you that peace of mind. The confidence comes not from just working and earning, but I feel that the confidence comes, like you said, from knowing how much is enough. I think that is the question that needs to be answered in this session for all doctors. How much is enough for me? How much I need? How much will this money that I have last me, even if a single penny doesn't come to me because of any reason, whether I am not working or involuntary, I'm not able to work for any reason, will this sustain? Because life is full of uncertainties, just like COVID. Anything can happen. It's full of uncertainties. You have to plan for emergencies. You always have to have a plan B. And so there came the 3-step retirement plan, which we took you guys through it. What I'm going to do right now is I'm going to take you guys through this 3-step retirement plan. I am right now going to even share it on the chat with everybody so people can download. Please click on the link, guys, whoever is logged in. Download it. It takes you through 3 basic steps of retirement planning. And then there is also another link where you, if you find this information good for you, you want to know a little bit more, at your own convenience, you can contact us and figure out whether you want to have a session just completely complimentary for you guys on OrthoTV. So I'm just going to put that link, just see if you receive it, just a second. Has that link come?
No, not yet.
Dr. Neeraj?
What we will do, Chanda, is that we will send it at the end. So because this link will be only on the Zoom for only 4 or 5 people.
Okay. So here when I'm sending it to everyone, people will not
Yes.
get it, is it? Yes. Okay. So there are 2 links, Neeraj. I'm just, putting it on the chat. You can take it and I'll also send it to you separately. Yeah.
Okay.
So
Just share your screen and show us.
Yeah. So that's what I'll do now. Once they go through this, what really happens. So this will give an idea what we do with people. So I'll just share the screen. Is the screen visible?
Yes.
Yeah.
Enough? Numbers are big enough?
Yes.
Yeah? Okay. So what I'm going to do is I'm going to just leave the screen blank, okay? And I'm going to just talk about this. All right. So when we meet doctors and we talk about 3-step retirement plan, the first step in retirement planning is to just figure out what is that age that you will want to slow down. And when I ask this to doctors, most of them say, I don't know, maybe 60, maybe 70. So they put some number in their mind when they think that it would be okay. I always tell them to plan a number, to think of a number where they may not work for 12 hours, but they may work for 6 hours. And that's also good enough, or they may stop working. So let's just take that, anyone in the audience, let's take an average age when doctor has worked for 15, 20 years and has reasonable savings that he has done. So let's say that there's a person who's 55 years of age. And let's say typically the age when people like to slow down, after meeting so many doctors, we've realized it's around the age of 65 that they've told us that I would want to slow down. Now, when you see 55 to 65, you have to therefore plan for 10 years, you have to plan for it. But the planning always should be done for the maximum age. So the age where we say that people should plan for is 90 years of age, because with medical advancement, the age that our average age has gone up. So 90 is the max age that you really need to plan for. Now, we don't want a situation where we outlive our savings. So if that is the case, so that is the first step, determining the age you want to slow down. Whether or not you slow down is irrelevant. Second step in retirement planning is to properly think, what is the income that you as a couple, you and your spouse would need in case you retire and not a single penny comes. For any reason, a single penny is not going to come from your practice. You need the money to run your house, to have the same standard of living. What are those expenses? And I'm telling you, 90% of the doctors do not have this number in their head. And they say, I don't know, it could be this. How do I tell you? After 15 years, my expenses will be different. So the simple thing I tell them is to do this. And this is such a basic thing, but it needs to be jotted down. These are the expenses that you should think about. What is my lifestyle expenses? Basically, lifestyle expenses is our eating, food, our groceries. We always have helpers and we'll always need helpers around, and we always have to take care of them. The helpers' expenses, transport, petrol, driver, the regular bills that we have to pay, whether or not we have income coming in, electricity, AC, mobiles, Wi-Fi has become a big outgo nowadays. Entertainment, meeting our people, socializing, going out, shopping probably. medical expenses, the medical expenses which may come up. It could be dental treatments, it could be anything else. Gifting. Many people have told me that, gifting is, keep aside at least 5,000 a month for gifting. It all depends from family to family. White goods. We are in an age where every few months we end up buying white goods, whether it's a mobile phone or a gadget, or we change TVs every 3 years. What is our travel budget? Another thing is traveling. Keep your travel budget also. Like, we have doctors who say, oh, 10 lakh, maybe, once I slow down, I would want to travel more, and I would want to travel, maybe visit my kids who are in the US, and also travel somewhere abroad. And also keep a buffer for unseen expenses. So when I have done these calculations and sat down, it takes 5 minutes, but jotting this down in the memory helps people to say, oh, okay. And mostly I have 2 lakh rupees per month, probably is my expense, close to 2 lakh, or it can be 3 lakh rupees a month. Something like that, a figure they come close to, they get a budget in their head. So that helps them. Let's put this figure. So we have reached the second step with a very simple calculation. What is the age that we need to slow down? What are the expenses that we have currently, which will continue in case we slow down? Also remember, by the time you slow down, you're also at a stage where you may not have EMIs, where you may not have obligations, you may not have too many insurance premiums to pay. When we do this, we come to the third step of retirement planning, which is, what is the inflated retirement income that I need? Most doctors miss this point because inflation is almost 6 to 7% in our economy. This is historical figures that I'm taking. And with inflation means, you obviously know what I can buy with 1,000 rupees today, I will not be able to buy with 1,000 rupees 10 years down the line. So what we have to plan for, if you see with 6% inflation, when I'll be age 65, from my current age 55, my 2 lakh will actually be worth 3 lakh 58. So I have to plan for 3 lakh 58,000 and not for 2 lakh. Second point over here, 3 lakh 58 is only at the age of 65. You have 25 more years to go. So 6% year on year for next 25 years. So you have to plan for this 3 lakh 58 going bigger and bigger and bigger in the next 25 years to come. So when we do this calculation comes the fourth step of retirement planning, which is, what is the number that I need? What is my magic number? What corpus do I need? And if I take this case, the corpus that comes is almost about 8 crores. 8 crores is the corpus this person needs if he wants to slow down with no income coming in. And this money should be able to sustain him till his age 90. Whether or not he works, he will live a good standard of living. Now, here comes the next technical question that I face. Either the doctors say 8 crores is too much, I don't know if I have this money, and that's where we have the plan where we help them to build this 8 crores, which is possible with 10 years, 15 years of work experience left. With the right kind of planning and allocation, it is possible to build this crores. But there is also a case where there are doctors who think, oh, I have a property worth 2.5, 3 crores. I have insurance policies, they'll give me 50 lakh. I have mutual funds, I have stocks. Oh, mera ye 8 crore ho jayega. So that therein comes the last and final step of retirement planning, which is 8 crore aa jayega nahi hota hai, because it is easy for this 8 crores. They can become 7 crores and 6 crores also, depending upon what happens in the economy, what happens with the rates in the economy, what happens with the market. We have seen cases where 1 or 2 wrong decisions and the corpus has come down. And then you don't have 30 years to make this corpus again, which is why it's your hard-earned money. It is very, very important to decide whether this money is going to last you or not. And this is where I will tell you what becomes important. So this is the basic retirement calculation. You get your magic number. Now, what to do with magic number is the most essential part of retirement planning, which people don't understand. Because here is what people say, I have real estate, I have policies, mutual funds, blue chip stocks, fixed deposits. It will come to 8 crores. But here, what is important to decide how to effectively manage 8 crores. Lots of people have money. Even at the age of 43 today, I have enough corpus that in the next 7 years, I can retire. But how effectively this corpus should be managed depends on these factors, which I've put down on your screen right now. This is like a balanced diet. Where have you put your money? What is the allocation to the different investment buckets or the different investment vehicles, assets that you have? Insurance policy mein kitna hai, fixed deposit mein kitna hai, real estate mein kitna hai? Because all these different assets will give you different returns, which will have an impact on your corpus. Second is, what is the risk in your portfolio? We have seen doctors who have put lots and lots of money only in fixed deposits and very little in mutual funds because they don't understand mutual funds. Or we have doctors who've invested everything in stocks and they don't really keep money in fixed deposits or debt funds because that's something that they don't like. They think they like to take risks. So what is the risk in your portfolio and what is your risk appetite? Different from different doctors. Just like every patient, a medicine is going to be different for the same treatment, for the same problem. Similarly, for each doctor, this retirement calculation is customized. For Dr. Ram Prabhu, it was different. For Dr. Neeraj Bijlani, it was different, and it will be different for everyone else. Third is, again, the corpus determination also depends on what's important to you. Do you want to protect capital and therefore take lesser risk and reasonable growth, not run behind returns? Or you're a person who's ready to take risk. Even if you see losses for some time, are you ready to take risk? Then your corpus requirement may be different. It may not be 8 crores. That is a third important factor. Also important is at what life stage you are. Are you in your 40s? Are you in your 50s? What is the investment amount that you have? What is the saving you have done till now? What is your current financial situation? Do you have obligations? How much is your EMI? Are you covered sufficiently in life insurance? All these factors play a very important role in determining your retirement corpus. And finally, obviously, what is your vision for your future? What is the lifestyle you want to lead? And that affects your need and which will affect your corpus. So these factors determine these 4 steps in your magic number in your retirement calculations. And let me show you, once you've done this, once you know your corpus, once you have decided, okay, if I have an 8 crore corpus, these are the changes, this is how I need to manage it well. After that, how will this money last me? Let me also show you that calculation. If this is clear on your screens, let's assume that you've got a 8 crore 20 lakh corpus. You are at the age of 65 and you start withdrawing money. Now, if you look, the withdrawal that you do per month is 3,58,000 into 12, your inflated figure into 12 months, what you need. You withdraw this money, you're not earning anything, your corpus 8 crore 20 is still growing. That is because of the asset allocation, the first factor that I spoke to you about. You're using a little amount, but your remaining amount is growing. That is how your corpus the plan needs to be put in place. At the age of 66, with 6% inflation, you will withdraw even more. You're withdrawing 45 lakh rupees. At the age of 67, you're withdrawing 48 lakh rupees. If you keep doing that, if you see every year, your withdrawal will keep increasing because there is inflation of 6% every year. To the tune, now this may happen, may not happen. You may not need to withdraw this, but it's always good to plan for it. And if you see at the age of 90, you're withdrawing close to 1 crore rupees. 25 years of inflation has come into the picture. More than 1 crore 50 is what you're withdrawing. And if you look at your corpus is sustaining itself. In fact, there is a point where your corpus is growing to 9 crores, 10 crores, even though you're withdrawing and not using a penny because your investments are earning a reasonable rate of return as compared to the inflation. But there will come a point where as your expenses increase because of inflation, your corpus will start reducing. And if you see by the age of 90, you don't outlive your savings, but your corpus can come down. So if you see here at the age of 90, your corpus comes down to 1 crore. Now, this is the hypothetical situation. Now, there are situations where doctor tell us, no, we don't want our capital to get affected. Super. In that case, what you need to do, you need to up your retirement corpus, what you want to build. Now look at this game. If you decide that you can make a retirement corpus of 9 crores and not just 8 crores, if you look at the same calculation that I did, at the age of 90, you have not touched your capital. You are at 8 crores 89, which is 9 crores only. Without touching your capital, only on interest, you have been able to sustain. So there are complications here. There are factors that come into the picture, your interest rate, your inflation, the corpus you need to build. What is the corpus you need to be left behind? Do you want to leave something behind? Or there are some doctors who say, I don't want to leave anything for my kids. I've given them a good education. Now let them take care of themselves. I want to enjoy my money. That will change your retirement corpus. So this is how retirement calculation is to be done. Like I said, all these factors, your risk, your overall post-tax returns on 9 crores, not just mutual funds. Some mutual funds can give you 20%, but fixed deposits will give you only 4%. There are some stocks that can give you 100% return, but some stocks may not give you 100% return. So overall, how your portfolio is doing will impact your retirement calculation. And you should have a plan in place such that you don't know what will happen in 20 years. You don't know what will happen. Who will be ruling this country? Is it going to be Congress? It's going to be BJP? It's going to be Narendra Modi? You don't know what is going to happen. But in spite of all that, you need that 2 lakh, you need that 3 lakh 58 in your bank account every month. And that's what you need to plan for, and not need to plan for mutual fund stocks. They are products. They are that medicines which are available on a counter. Medicines is not important. The treatment, the strategy that the doctor is using, that is important. And that is the retirement calculation we talk about. Here, I'll give you a very small example. Just recently, I met a doctor client who just wanted to retire. And this was his need. I've just encapsulated everything we spoke about just now. His retirement need was 2 lakh rupees only a month, and he wanted an annual vacation of 10 lakh rupees. So we calculated his magic number, and his magic number was 5 crore 85. And it was like, if I have 5 crore 85, I'll be fine. So when we did this, first he was like, how will I do it with 5 crore 85? How will I sustain? Really, will it be enough? And when we did this calculation for him and showed it to him, 2022, he starts his retirement, which is next year. He'll be 70 years of age. He needs 24 lakh rupees. 10 lakh rupees is his retirement. 34 lakhs is the total need. And this is how his money will flow. And the plan was in place, where the money should be, whether this return will be sustainable for 20 years. Everything was put in order for him, because it was only 1 year to retirement. We didn't want a situation that markets tank and suddenly he says, oh, 5 crore ka 4 crore ho gaya. We didn't want that. So every plan was put in place, and we showed him that till the age of 90, he would still not touch his capital. And he is this close to retiring if he wishes to. So next year, if he wishes to, he can retire. And that just gave him such a sigh of relief, even after COVID situation. So this is the retirement calculator. This is the link, Dr. Neeraj Bijlani, that I was talking to you about, which you can send it out to the group. And I will stop sharing this. I hope people have understood what we are talking about over here in terms of retirement. Dr. Prabhu, we have done this with you, and we have reiterated and done a lot of situations like this during COVID for you. Could you just conclude by telling what was the feeling that you had when this was done for you? What feeling it gave you? What peace of mind did you get? And what would you tell the people, youngsters or experienced people who are listening to this, when you did this kind of a calculation?
Ram will sum it up, but I can tell you one thing. I was, like very conservative, and we had a lot of FDs, because what I felt, it is tangible. I can access it. The bank is just outside our doorstep in our compound. And at any time, I would get an overdraft if I wanted to do some things. So I never felt helpless. Whereas Meena and Chanda both told me, no, 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 there's something like liquid fund. If you want it, you will get it at any time. And within 24 hours, it will be in your account. Now there is net banking. You don't have to worry. You don't have to see. So this time we actually tested them. I said, let us try and see what they've been talking, this liquid fund, whether it really comes into our bank account. So, not for ourselves, but there was a need for one of our relatives who needed a hefty sum suddenly. I said, let us see. They've been always saying you'll get it. Let us see if it happens. And really speaking, within 24 hours, I mean, I would say a Saturday came in. That is why I took one extra day, but the money was in my and Ram's account. And that made us feel even more confident. Well, if we have to pay some huge bill from some hospital, or if we need it for some crisis, we can access this money. We need not keep it in an FD. We need not keep it in the bank where it is going to earn only 4% interest. So that is what gave us a lot of confidence about FDs, which many of the doctors keep in FDs because they feel, okay, it's near me. It is, I can touch it. I'm in control. I don't want Meena and Chanda to be in control. Who knows? They may not pick up our phone. Then what do I do? But they, this way we tested this for ourselves and we were more than satisfied. So, I mean, I want to make this point because many of the doctors feel this about, and even we felt about it.
Yeah. In fact, FDs is one thing that all the doctors put their money in. I've seen them in my friends, most of them, the younger friends as well as senior friends too. We believe in FD. And Chanda and Meena convinced us that FD is not the right way to go. And we sort of listened to them, we trusted them, and we are not regretting. And that is really a great thing that we learned from them, that the money should earn by itself, and that is what really, and it should be more than the inflation rate. So that is what the interest should be more than the inflation, and that is a simple calculation which they showed, and we are really happy about it. Last 4 years, we are really happy with the whatever the advice that they have given, and we have followed them to the T.
Yeah, no. And my last one message would be to all my colleagues who haven't gone through this process with someone, or the younger generation, that is the ones who are my children's age, that do plan right from the beginning. I mean, we lost out on many, many years, but anyway, never too late. Like you showed this example of the 70-year-old. So it is never too late to begin. And so don't think, that you don't have, you get an immense sigh of relief, and you will be able to pursue your hobbies tensionless. You don't have to. It's like finding a good doctor. Sometimes patients are like, abhi hamara case aapke haath mein, aap karo, hum bindas rehte. So that is how I look at it, that we really are more than anything just relieved that, well, there is somebody who's looking after our interests. Thank you so much.
Thank you. Thank you
Thank
so
you.
much.
We are not allowing you to go. We have still panelist questions coming up. So, Doctor, as you can see, Dr. Sanjay there is waiting in the car and listening to your whole talk. So, sir, do you have a question for them or Chanda? Just unmute yourself. आवाज नहीं आ रहा है. हाँ, yes.
We can't hear.
Yes.
Can't hear.
Sir, headphone लगाया होगा आपने. You must have put a headphone.
कार का फोन.
हाँ, yes. अभी सुनाई दे रहा है. Now we can hear.
तब तक you can ask some.
Okay.
Prasad, you can ask a first question then.
Yeah, I mean, the presentation was very self-explanatory. I mean, there's no much, but I would just like to ask, at this particular, if somebody starting very late to think about his retirement, and how does he reach that particular figure? I mean, if he's starting off late, because it's very difficult to, I mean, if my figure comes out to be 6 crores, how will I be able to reach that particular figure right from now? If I plan to retire at the age of 60 and I'm 45 now, and if my magic number comes to be 6 crores, how do I reach that figure?
That is exactly what MFA is going to tell you how to reach that figure. In fact, we also started pretty late. We are 67 now, and we started about 4 to 5 years ago. So that was pretty late in our life. But then they made us realize that when we did the calculation, and we had to be absolutely transparent and truthful to them, giving us the details, giving them the details, and we realized that we can really reach the figure that we are talking about. So it is possible, once you sort of get down to your desk and write down all your things, it's possible that you have those kind of money.
Oh, and every 2 months, we do visit their office. We insist on seeing exactly where we stand, and like make them explain to us that where our money has grown, or whether it has stagnated, or whether the capital is intact. So all these things they do insist that not only one but both the spouses jointly or separately do understand what is happening. So that even gives a clarity and peace of mind, because basically doctors always have this feeling, is it enough, is it enough, so once you know
Yeah.
it's enough, then there's nothing to worry.
In fact, Prasad, just to tell you that it is very important for us to know where we stand, and that is what exactly happens. And without mincing words, I say that doctors are really poor accountant and financial planners, most of us, and we were not exception to that. And we realized that it's a professional advice that we require. It's like orthopedic surgeon tomorrow, he may be doctor, but if I am asked to do a delivery of a patient, I will not be able to do. So it's a specialized field. Finances are the specialized field, and they have to be uh, uh, learned from those people who are professionally managing. You and me are not the ones who can really manage. It's like tomorrow we have some medical legal case. We can't go and fight that medical legal case unless we have some help from lawyers. So similarly, this is also a professional help that we require.
Yeah, and other
Dr. Prasad, also, like you said, you're 45 and you want to, I think I heard you want to probably slow down at 60, right? So you have enough time. I mean, this is the time when you really can build up. The good part here is at least you need to know where you stand versus where you can stand, and is it possible? It doesn't have to be that you have to reach a 8 crore or a 10 crore figure. Even if you come close to it, you know what are the baby steps that you need to take. That is what is most important. The taking the first step is most important, right? So you have to do that, and you will realize, and this is our experience. We even do a step by step. We say, okay, you don't see the last, don't see the goal. What is the first next right step to take, and the second step, and the third step? We will take a look at your situation and guide you to what's possible, what's not. And trust me, most of the times with the doctors, we have seen that 45 to 60 is really the age where they really ramp up and they are able to come close to the retirement, whatever which it may be.
Can I add something here, Chanda? See,
Yeah.
many times when we have recommended some of our genuine friends, because we thought it has helped us, they've always asked a second question: how much do they charge? Do they charge a lot, or do they, how much of your profits do they, are taken away? And as it is probably from all the instruments that they invest in, they must be getting some percentage, maybe 0.5%, 1%, and all that. To all the people, I mean, both of us, I can talk on this. I feel that, see, it's none of our business to know what you get from somewhere else. As long as it is you've been working for it, if it is in the legal trajectory to get it, I mean, it's none of our thing, because see, today we are doctors. We have a reasonable, charges, like, this will be a consultation fee, this is an operative fee, and no patient as such grudges at the moment. At the most they ask us, please give us a concession, doctor, we can't afford it, or something like that. And I've seen that happening with y'all also, that some genuine cases you probably would not even charge, or be very considerate, especially someone who are youngsters. I mean, if they're just starting off, how could they pay a hefty amount? So I don't think anyone should really crib if one is getting his money's worth.
True. True. So, however, the session here is complimentary, and we are not charging anything, and that is the norm. So, as per the compliance requirements, we do not charge any particular annual fee as such. And retirement planning and financial literacy is anyways one of the things that we do on a regular basis. So, this is an attempt towards that.
Okay.
More questions?
Yes. So next question will be from Dr. Sanjay sir.
No, I don't. Basically, see, I just wanted. My question is not something. My question is basically everybody. So there are lots of people now who have a lot of knowledge, whether through social media with sessions from Neeraj. I think many doctors now end up doing sort of a diverse investments like stocks, mutual funds, sovereign gold bonds. So knowledge is so much easily available now. So how would an agency like you or a people like you, how would you advise differently so that always listening to you, you feel insecure whether you're doing it the right. So how is it different? Your planning is how is it different?
Okay, okay. So, doctor, I would like to answer it in a different way. Okay. Now, like you said, everyone is doing mutual funds, stocks. Everyone knows these things are there, right? Fixed deposits hai, bond hai, PMS hai, government का कुछ आ जाता है, government sovereign bonds hai. Everyone knows these are there, but these are all products. These are all medicine. So if as a patient, I suppose have a stomach ache, I have an option to go on Google, research, find out क्या हो सकता है मेरा stomach ache का cause, and find out different medicines etc. over the counter. I can go to a chemist, I can phone somebody, do some nuska, or the other thing is I can go to a doctor who will give me the right 360-degree advice on what it could be. Now we follow the same process, Dr. Dhar. Our process a is like a pyramid. It's similar to a doctor's practice. When a patient comes to you, what is the first thing that you do? First is you will understand the patient's problem. You will understand the patient's history, which is what we'll do. So I will try and understand with Dr. Dhar. You have investments, I know, that's fine. Everybody has investments. But what is it that you want investments to do for you? What are the goals or what is the purpose that you are saving and investing this money for? Understanding that. Second point would be to therefore understand your financial fitness. It's like a balanced diet. You will tell me to do a blood test. You will tell me to get an x-ray done. You will tell me to do something else done. I will first try and understand where all. So you said you have mutual funds. How many mutual funds do you have? Which mutual funds do you have? Are these the right mutual funds? Are they very risky mutual funds? Are these good AMC companies, or are they only the ones which are showing great returns for 1 year, but मैं 10 साल के पहले का return देखूं तो it is very nalla. So what kind of mutual funds you hold, what stocks you hold, how many you hold, what is the allocation, what is the balance in your life versus what is the need that you have, what are your obligations, what is the expectation of your income, what are your dependents, what is your medical cover, do you have obligations, and if anything happens to you, does your family have enough insurance cover that even if there is a 2 crore that they need to pay off, they are able to pay off. Understanding your full financial situation is done. And third, then we will tell you, therefore, okay, Dr. Dhar, you have all this, but this, we create different pockets. This money is the amount you need for emergency. So you have to keep not your mutual funds, not your fixed deposits, but liquid funds of worth 20 lakhs. So we'll give you a figure which will be a trigger for you. Anything more than 20 lakhs, I don't need it as an emergency. I can keep this money aside. So emergency planning, then creating a pocket for travel, creating a pocket for retirement, creating a pocket for your kids. We have people who've come and told us to create a pocket for doing charity every year. There are people who've come to us and say that we want to create a small corpus which will be a down payment for the house that I want to buy or a clinic property that I want to purchase 5 years down the line. So our value add really is in terms of making a plan for you. Products will come into the picture anyway. So we are not talking about the medicines, the products, we are going to talk about the treatment. So making the plan, being your advisor who has a holistic view in life, a person who coordinates with your mutual fund agency, a person who coordinates with your insurance agent. That is the role we'll play, and that is where we are different, and we help the person to understand what planning is really about. Because otherwise, so you go to HDFC, you go online and you'll get a mutual fund. Nowadays, there are apps. You go to Money Control, or you even go to like a Paytm, and there are apps to make payment to have your mutual funds, right? So products are not planning. That's the point. Products are not planning. Financial planning or planning for your retirement, planning for anything is not about products, but having a proper process in place and a 360-degree view in place. Products will naturally come, by the way, and they'll be the same. They'll be mutual funds, but they will be picked for you. And the mutual fund that I pick for you may not be the same which I pick for myself, given my life situation, my life stage, my requirements, my risk appetite. I hope I've answered your question.
Yeah. Thank you.
Okay, Sachin.
Yeah, nothing. It's nice presentation as usual, and very nice to see Ram sir and Meena madam. Actually, 2-3 things which I want to tell always, that Meena madam has always told that 2 points which I feel is very nice, is that joint practice. It makes a lot of difference, especially in orthopedics, what I feel, which at least I practice with Pramod, Prasad and Dhar sir, but obvious. So we have a good joint practice, and it really is a good stress buster and also discussion. Same way we discuss the stocks and finance planning. But listening at the lecture, I feel definitely it is a specialized subject and the expert should handle. But most important thing is that we should always, after 1 month or 2 months, do checkup. Where are we heading? And always so that there is a coordination and transparency is maintained.
Correct. True.
Very, very well said, Sachin. Very important that whenever there is a partnership, especially in two doctors, why do the partnership fail in some cases? One is money, of course. There has to be total transparency among the partners. And second is ego. If there are two orthopedists, everybody feels that they can do something, and why should the patient go to other? So these two things are very important. If you can handle that successfully, I think any partnership will work. If your marriage can work, why can't your partnership?
Absolutely.
So I think this is very important, as you said, and I think that is the way to go in future. And I think lots of youngsters are having those ideas, but they should actually, people like us, seniors, should help them to establish those group practices.
Sir, his wife
maybe
is
want
also...
to add one more point.
Yes.
Yeah, maybe want to add one more point, that as this is a little more specialized, let the expert handle, but most important is that the discussion should be there, because I feel you can read apps what I'm saying, but sometimes it is confusing.
Correct.
So you should know where are we heading and
Absolutely.
Information is there, doctor, but what is the relevant information for you? What is valid for you is different. Otherwise, Google Baba to everyone can read so many dailies. There is news at the tip of the button, but that is not what it is. That's data. That's not valid information.
You can't really swim with reading the books. You got to really...
Correct. You have to get into the pool.
So it is very important that experts should manage the expert's business.
So there is one thing special about Sachin and Sanjay Dhar is that both their wives are also gynecologists. And both of them have their own nursing homes also.
Okay, very good, very good.
Yeah. So with this, I think we just say a vote of thanks to my financial advisor and the people who have been listening, and also to Dr. Ram Prabhu, Dr. Meena Prabhu, and my three very good and friends, and these friends whom I used to regularly meet, but because of COVID, I'm only meeting them when there is a surgery involved. So with this, I would like all of you viewers to just go to the YouTube channel, and you can see that form is already there, and you can click on it, and maybe you can avail for the complimentary consultation. It is like a 30-minute complimentary consultation, and it has no strings attached. If you don't wish to continue with them, you may not continue with them. And there is one comment. I am associated with, this is our regular viewer, Dr. Kamal Tolani. I am associated with MFA since last year, and I must say they are absolutely professional and offer great value and help.
Great.
Great. Thank you so much.
Neeraj, are you saying that if you want to be successful, get married to a gynecologist?
I am not married to a gynecologist. I really don't know.
Okay.
Okay, thank you, sir. Thank you very much.
Thank you. Thank you.